Premier Mark McGowan, thanks for joining us. You've been quite critical of the New South Wales government's approach to this latest outbreak. What do you make of the approach and rhetoric that Gladys Berejiklian has taken?
Well, we just want them to get it under control, and for the sake of the people of New South Wales and also for the sake of the rest of the country. And the approach we've adopted on 3 separate occasions was to lock down the entire metropolitan area fully, do it immediately, put in place our contact tracers, and basically crush and kill the virus. And we did it every single time, including with the Delta strain. So that was the approach of Adelaide recently. That is the ongoing approach of Melbourne and Brisbane. And I think that's the approach the New South Wales government needs to adopt.
All right. Well, when you're looking at 350 odd cases a day, though, is it too late for New South Wales, do you think, with the Delta strain? Or do you think a tougher lockdown can do the job?
Well, Melbourne did it last year, you might recall. We did it, as I said, a few months ago, and Adelaide did it recently. Now, obviously, New South Wales delayed putting in place the measures that worked. They obviously believed all that stuff that was written about them being the gold standard and all that sort of stuff, which was clearly a mistake. But now they just need to take the measures that work. Lock down properly, put in place roadblocks around Sydney to prevent the virus from escaping to the country. Lock down certainly the areas that have got it in the country, perhaps more. And I'd also suggest the Commonwealth needs to roll out more Defence Forces to assist in actually keeping it under control across Sydney.
Well, you've actually accused the government in New South Wales of having no backbone, haven't you? You've gone that far in terms of what sort of measures do you think WA had in place that they don't have in place?
We put in a lockdown across the entire metropolitan area and the adjoining regional areas. The lockdown didn't have exemptions for some local governments with lesser restriction than other local governments, so it was just one rule that applied to everyone, so it was easily understood, and it was quite, I'd go so far as to say, very severe and strict. So we put that in place. Secondly, we put in place a mask wearing requirement outdoors for everyone, no matter where you were in any of those areas, entire metropolitan area, entire adjoining regional areas. Thirdly, we put in place roadblocks around the city to stop people going to the country, and we cracked down on people going out through the airports. All those things we put in place, and they all worked.
Well, Gladys Berejiklian has said multiple times she thinks she has the toughest restrictions. What do you make of that comment?
Well, it's not accurate. So if you have a look at what Melbourne did last year, Dan Andrews, the Victorian government, Stephen Marshall in Adelaide, what he did recently, what we did a couple of months ago, we had the Delta strain come in from Bondi at the start of Sydney's outbreak. As soon as it arrived, we put those measures in place and the measures worked.
Have you discussed your concerns about this with Gladys Berejiklian and or Scott Morrison?
At National Cabinet, we have wide-ranging discussions about this. And, the view is, by all the states, is that we have to follow the roadmap that was agreed by all the states in the Commonwealth, which is we crush and kill the virus, or we eliminate the virus with no community spread until we get to 70% and 80% vaccination rate. Now, that's the nationally agreed approach. Every state in Australia and the Commonwealth has signed up to that. I keep hearing that the New South Wales government is moving away from that. That is not the national agreement, so I just urge New South Wales to adhere to the national agreement, and I also urge the Commonwealth to more fully use the Defence Forces. I understand there's a couple of hundred soldiers out there assisting. I think the Defence Forces have to be called out to a far greater degree to assist, particularly in Sydney.
All right, well, let's talk about that roadmap and let's talk about a WA population being 70 or 80% double vaccinated. Is zero COVID still the goal if you get to 80% double vaccination in WA, or do you accept then there have to be some COVID cases and deaths in WA?
Well, our preferred option is zero COVID, obviously, and that's what we'll attempt to do. And we don't want to have deaths and we don't want to have spread of the virus. So. But there can be some easing of some of the rules. So, for instance, when you get to, I think it's 70, perhaps 80, we'll have less, if there is a lockdown, it might be a lesser area rather than the entire metropolitan area. It might be a country town rather than an entire region. So We retain the right to put in place borders, that's understood, but some of the measures that are put in place might ease once we get to that level of vaccination.
Okay, so we're facing a potential scenario here where New South Wales never get to zero again, in which case, even at 80% vaccination, would you have a hard border up to them?
Well, we retain that right. Obviously, I'd prefer not to. My own mother and father and my brother live in New South Wales, and personally, I'd love to be able to see them. And I know there's many thousands of people in that position, and other people would like to go to New South Wales on holidays or for business or whatever it might be. So clearly, I'd prefer not to. But look, the best answer I can give to that is for the foreseeable future, probably to the end of the year, we'll have to have some sort of strong border in place with New South Wales because we can't run the risk of it infiltrating into Western Australia. It's happened before from New South Wales. We don't want it to happen again.
Well, Scott Morrison's hoping with 80% vaccination, the state borders are basically open. It doesn't sound like that's where you're heading. You want to retain zero COVID.
Well, what we've said, as I said, I'd like to get rid of the borders. I mean, my mother and father are over 80. I'd love to be able to go and see them, as would many people, so I'm not unusual. But I can't run the risk of the virus coming in. So all we've said and what we agreed at National Cabinet and what the High Court confirmed in the Clive Palmer case, you might recall, is states have the right to put in place the border if necessary to protect themselves from the pandemic. So clearly we've brought the border down before. If they get it under control, we can bring it down again. At this point in time, that's not happening.
Could we see WA sort of cut off from the rest of the country if states go an opposite route to zero COVID and almost become like New Zealand in terms of its border restrictions and its lack of willingness to accept COVID?
Well, we're very strong on it, but other states have done the same. So, Victoria, Queensland, South Australia all have borders with New South Wales, Tasmania as well, Liberal states, Labor states. It's not unusual. In fact, it's now kind of the norm. But obviously we've had the strongest rules in place, and because we have the nullable between us and the East, we have that weapon that allows us to prevent the virus coming in. So I suppose we do have some similarities to New Zealand because of that isolation and distance. But when you say we're completely isolated, we're not. We still have, obviously trucks and trains that come across delivering supplies and goods and services and the like. We still have some people come in for compassionate reasons, or defence officials or Commonwealth officials or the like. So there's still that connection that is a risk. But as I've said constantly, other states have got it under control. It's up to New South Wales to do the same. The Commonwealth can assist them. And once they do that, well then obviously when they get down to zero or minimal community spread, then we can look at opening the border.
I just wonder going forward over years and years, how realistic is the zero COVID goal when the virus is throughout the rest of the world? I thought the idea was, and you may have a different view here, that when there was enough vaccination coverage, it would become like the flu. Scott Morrison has referred to this. Is this not your view? Do you still think ICUs would be overwhelmed, say, at 80% if you just let the virus go in WA?
Well, when you get to 80%, it makes it far more easy, and we ease some restrictions. But just not wanting to be repetitive, but National Cabinet has agreed states have the right to put in place borders if necessary. So that is something that is there as a tool in our toolbox if necessary. But I'm looking forward to getting to over 80%. Apparently no country in the world's got there yet, but once we get there, obviously it'll become a lot easier and all these decisions will become a lot easier. But we're nowhere near that yet. And I think we need to make sure before getting to that point that we eliminate the virus. And when people say, it's all impossible and the like, I just think there's a short memory out there. Victoria went through hell last year. And, the Andrews government did what it took to eliminate the virus in Victoria. They did what it took. And remember the screaming and yelling and undermining and sniping and mad carry-on that went on across Australia about what the Andrews government was doing, but they did it. And, there's a template for you as to what can be done if you have the willpower to do it.
Do you think then WA will get to 80% double vaccinated. Do you think that can occur this year? And will you look to do what South Australia's just done and make Pfizer available to all ages soon?
Well, it all depends upon our supply. If we get additional supplies like New South Wales, Victoria and Queensland have, we'll be able to massively increase our vaccination rate. That will get us above 80%, we expect. But we need the extra supply. We haven't got the extra supply, unlike the other states have. So that at that point in time, hopefully that will be this year. People are just willing to get it, but there's just not enough supply for us of Pfizer. There's obviously hesitancy around AstraZeneca. Personally, I had AstraZeneca. I was fine. I'd encourage people, if you're eligible for AstraZeneca, go and get it. But we just need to get more vaccines so we can roll more out. And I would expect, I can't guarantee it, but I expect we'd get to 80% around the end of this year, perhaps early next year.
And do you think employers should be allowed to require their employees to be vaccinated? Would you like to see Scott Morrison take ownership of this? He's indicated this is a matter for the states. What's your view on it?
I'm keen on that. And it may be just some workforces. For instance, all of our hotel quarantine workers are required to be vaccinated. We just put in place a public health order requiring our aged care workforce to be vaccinated. We're currently looking at our health workforce and our ports workforce. Our ports deal with ships that sometimes have COVID on them. Our mining industry in Western Australia, which basically carries a lot of the national economy, vaccination for people working in mining is incredibly important, not just for the economy of the country, but also for the finances of the country, because it funds a lot of the services here and over east. All of those sectors would be priorities, but I'm actually not opposed. Especially if the workforce is one that has that importance or that contact with people who might be vulnerable or infected to getting vaccinated. So I've advocated for that, not afraid to say it.
Would you enforce it yourself, or do you think there needs to be national ownership of it?
We've already enforced it with the quarantine workforce, with the aged care workforce. We'll put in place further enforcement measures in the future. If there was a national rule about this, if the Commonwealth wanted to do it, that would help.
Just wanted to ask you a couple of questions on the federal scene now, just briefly. What's your view of Scott Morrison?
What's my view of Scott Morrison? I have quite a good relationship with him, and we get on reasonably well. My focus is achieving outcomes for Western Australia. I've worked with him to achieve those outcomes.
And
whether it's a GST deal, whether it's road funding, GST deal, road funding, rail funding, all those sorts of things, we've achieved those outcomes. I'm very much focused on what gets the best outcome for our state.
And Anthony Albanese?
I have a great relationship with Anthony. He's a personal friend of mine. What I admire about Anthony is his resilience. He hung in there and has hung in there for so many years over difficult circumstances. If you want to be a Prime Minister, you want to be a Premier, you want to be senior in politics, that's the most important quality.
So who's your tip for the federal election?
Well, I hope Federal Labor wins, but I've always found that putting bets on this thing is the punters are often wrong.
Thanks so much for your time, Mr. McGowan.
Thanks, Andrew.